Welcome to Save a Life in 1 Hour, a first aid course taught by real paramedics. In this module, you'll learn how to treat a patient who is bleeding. There are two main types of bleeding that I'm going to tell you about today. The first one is called internal bleeding, and the second one is called external bleeding. Internal bleeding occurs when the wound where the blood is coming from happens inside the body. Causes of internal bleeding may be car accident, high fall, or other types of trauma. Sometimes you can have internal bleeding due to medical conditions, such as ulcers. The way that you can tell someone has internal bleeding is by bruising, and sometimes they get very pale and sweaty. External bleeding occurs when you can see the wound where the blood is coming from. Causes of external bleeding may be a cut. Sometimes it may be a stab wound or even a gunshot wound. In external bleeding, you can see the wound and you can see the blood. The treatment for external bleeding is direct pressure and elevation. But just like all treatment for anything first aid, we need to follow our 7-step action plan. Doctors, A, B, C, D. D, the danger in this scenario may be the blood itself. If you live in a part of the world that has high rates of HIV or hepatitis, you need to be especially careful. If possible, use plastic gloves over your hands before treating a patient. If gloves are not available, you can use plastic bags, just like this. 2 plastic bags, one over each hand, works the same as a glove by creating a barrier. Make sure you tie the plastic bags tight around your hands to stop any blood coming down your arm. The treatment for external bleeding is direct pressure and elevation. We apply direct pressure by pushing directly onto the wound. You need to push hard to stop the blood. Direct pressure will stop bleeding in minor wounds relatively quickly. But with major cuts, it could take a lot longer than that, sometimes over 20 to 40 minutes. If possible, use medical supplies, such as a gauze. But if you don't have access to medical supplies, a clean cloth will do. First, apply the cloth and push down hard. Ask the patient, push down on that cloth for me hard. You can keep the cloth in place by applying a bandage. Bandage around the wound. And make sure that you keep the pressure. If you don't have a bandage, continue to hold the cloth with your hand or with your patient's hand. Once you complete bandaging, elevate the limb. By holding the limb above the heart, it makes it hard for the blood to get to the wound, allowing the wound to clot. If a patient has lost a lot of blood, their face may be pale. What we sometimes say is, if the face is pale, raise the tail. Lift up their legs above their heart. If you have a chair handy, use it to hold their legs up. What we're doing here is getting all the blood in their legs to come back up to their vital organs. In severe cases, such as traumatic amputation after a bomb explosion or a mine blast, apply direct pressure, the same as you would to any other external bleeding. Use the elevation, if possible, but keep that pressure on. If after a time blood continues to flow, we may need to apply an arterial tourniquet. You can use a scarf to tie around the limb and tie it tight. What we're trying to do is stop the blood flow, the circulation. Keep on tying it, tighter and tighter each time. If you don't have a scarf, a belt works well too. Wrap the belt around the limb, tighten it so it's extremely tight. If you do apply an arterial tourniquet, the patient must be taken to a hospital immediately. Make a note of the time that you put the arterial tourniquet on and make sure you let the doctors know. If a patient has been stabbed, the wound may not look that severe. If we see this wound here, it only looks maybe 3 centimetres long and quite shallow. But the reality is that the wound will be deep. If we look at this knife, it's gone in this far, meaning that the wound itself is probably around 5 centimetres deep. If the knife is still in situ, don't remove it. The knife may be acting as a plug to stop further bleeding. When you remove it, the bleeding may become a lot worse. Stab wounds may not look as serious as they really are. Just like any other external bleeding, we need to apply direct pressure. This may hurt the victim, so warn your patient. This might help you. We need to push down hard. Use a bandage if you have it, and get your patient to help you hold the wound. One of the most serious injuries that you may encounter is a gunshot wound. Gunshot wounds can be a little bit tricky. Firstly, as always, we need to remember our doctor's A, B, C, D. Think about the D. If the gun is still on the scene, make sure it has been made safe. Make sure that the person who shot your victim has gone. Next, you need to think about the wound itself. If you have a wound here, make sure to check around the back of the patient to see if there's any blood. As always, we need to apply immediate direct pressure to stop the bleeding. Just like before, we need to push hard. If there's no reliable ambulance service in your area, you must transport this patient directly to the hospital. If you notice that blood is seeping through the first dressing, don't remove it, as it may be forming a clot. Just simply apply another dressing directly on top. If you have to transport a gunshot victim in your own car to the hospital, make sure that you apply direct pressure on the wound at all times. The final topic that we're going to talk about in this module is a little bit less serious. It's nosebleed. The treatment for a nosebleed is simple. Ask the patient to lean forward. Get him to pinch his nose hard on the soft part of his nose, not on the bridge. Ask your patient to squeeze hard for at least 10 minutes. Tell your patient to never blow their nose or sniff. The reason that we have the patient sitting forward is we want the blood to drain out. If we were to place his head backwards, the blood would drain down the back of his throat and into his stomach and could make him feel very sick and eventually vomit. So ask him to keep the head forward and push down hard. Another little trick that you might want to do is pop some ice on the back of his neck.